The HSE right now is accepting registration for vaccination for those aged 35 to 39 and is scheduling appointments for that age group. And I announced yesterday that registration for those aged 30 to 34 will commence next week. I can confirm to colleagues this morning that the portal is going to open for 30 to 34-year-olds on Friday. So as has happened previously, on the Friday it'll be 34-year-olds, on the Saturday 33-year-olds, etc. That's how it's going to work. I can now confirm to the House this morning that we have, in addition to this, a significant acceleration of the vaccine programme beginning from this coming Monday. In short, the changes that we're implementing from Monday will mean that the 18 to 34-year-old age group will have the option of being vaccinated 1 to 2 months early. And that would have been really, really welcome, regardless of the Delta variant and this surge, but particularly in light of the modelling we saw from Professor Nolan's team as to what is likely to happen here through August and September in particular, to be able to pull forward a huge number of people from September into August and some from August into July is incredibly valuable and is really going to help us protecting each other, protecting our population from the Delta surge that we know is coming. So I recently sought advice from NIAC specifically for Johnson & Johnson or Janssen and AstraZeneca for the group that wasn't available for. So that's 40 and below. And it was in the context of the Delta wave. And so the question was, if we see this surge arriving here, which we're seeing in the UK, can the advice be updated to accommodate the higher risk of not taking a vaccine? Because the risk of being infected goes up. And whilst the data is still coming in and there isn't consensus yet in the scientific community, there are serious pieces of research that suggest that not only is it much more contagious, it's potentially also much more severe. So there's some analysis saying it's about as severe as the Alpha variant in terms of the likelihood to put any individual in hospital. There's other analysis from the UK saying it could be 2.5 times or more likely to put an individual in hospital. So obviously accelerating and making the vaccines we have available to younger people in the face of that threat, I believed was very, very important, and that essentially we could use every vaccine dose that we had, because without this change, what was going to happen was we were going to be left with supplies of Janssen, supplies of AstraZeneca, incredibly effective vaccines, and we wouldn't have been able to use them because everyone over 40 would have already been vaccinated. So the change from NIAC is incredibly welcome. So the online portal for the mRNA vaccines is going to continue, and we're all aware of that. And as I said, on Friday next week, it'll open for the 30 to 34-year-old group. Then they'll very quickly start getting appointments, and then vaccination for that group, first dose vaccination, will start about a week after that. The current estimates, and this is important for people aged 18 to 29, the current estimates for when their mRNA round of first dose vaccinations would begin are as follows. For the 25 to 29-year-old group, the estimate is early August, and for the 18 to 25-year-old group, the estimate is from mid-August. So anyone in that group who's thinking, okay, well, I'll be scheduled for an mRNA vaccine, but I now have an option of Janssen or AstraZeneca earlier, do I want to take that? Those dates are important for them to consider. So again, from 18 to 25, it'll be late August. From 18 to 24, it'll be late August. From 25 to 29, it would be early August. So in parallel to the portal we know for mRNA, from this coming Monday, we're opening up an opt-in model for the 18 to 34-year-olds. And that, as I said, is so that if they want to avail of earlier vaccination, they can opt into either Janssen or AstraZeneca. People will be able to seek an appointment in one of over 700 pharmacies across the country for a Janssen vaccine, subject to supply, and I'll come back to this, but we don't have infinite amounts. It is subject to supply. So that's from this coming Monday the 5th. The following week, the week of the 12th of July, 18 to 34-year-olds will also be able to register on the HSE portal for an appointment in a vaccine centre for an earlier vaccination. In the main, that will be AstraZeneca, and there will be some Janssen supply available as well. And the point is they'll then be vaccinated earlier than had they waited for the mRNA vaccine.